Welcome to RAAONLINE. As a part of tropical fever, now we will discuss about enteric fever or typhoid fever. So enteric fever is a severe systemic illness which is characterized by fever and very specifically abdominal pain. The organism causing enteric fever, as we all know, previously called as Salmonella typhi, now it is Salmonella enterica serotype typhi. And other Salmonella serotypes includes paratyphi A, B and C. And remember, human are the only reservoir for Salmonella typhi and Salmonella paratyphi A. Usually paratyphi infections are less severe as compared to the Salmonella typhi infections that we see. And the incubation period of enteric fever it varies from 5 to 21 days depending upon the inoculum, that is. So if it is a low inoculum, then probably the incubation period will be little longer. Okay. And now coming to the pathogenesis of enteric fever. So once how to acquire the infection is through consumption of contaminated food or water, right? So once that Salmonella typhi, after ingestion, successfully bypasses the gastric acid, and if it reaches the small bowel, then it starts its game. So in the small bowel, especially in the terminal ileum, okay, it penetrates the enterocytes lining the terminal ileum. What do you have in the terminal ileum? You have the Peyer's patches, the rich lymphatics are there. So they invade the Peyer's patches and where they multiply within the resident macrophages. Okay, and from there they can invade the mesenteric lymph nodes causing mesenteric lymphadenitis. So at this stage the patient can have abdominal pain, constipation or diarrhea. Okay, and from the lymphatics, from the lymph nodes and from the Peyer's patches, the organism can spread through the bloodstream or lymphatics where it disseminates into other reticuloendothelial organs. Okay, so this is the first bacteremia which occurs, which is also called as primary bacteremia. Okay, this is called as a primary bacteremia where from the Peyer's patches the organism invade the bloodstream. And usually this primary bacteremia is usually asymptomatic and even blood cultures may be negative at this stage. Okay. So after that, after primary bacteremia, the Salmonella typhi then now disseminates throughout the body and specifically it colonizes the organ of reticuloendothelial system where they again multiply within the macrophages. So it is intracellularly multiplying organism. Okay, it is a gram-negative bacilli which is multiplying within the macrophages. Okay. So the reticuloendothelial organ includes predominantly liver, spleen and the bone marrow. Okay, so it happily multiplies within the macrophages of the liver, spleen and bone marrow, and from there you can have a secondary bacteremia. So that results in widespread dissemination involving other organs also. And with the onset of secondary bacteremia, you have the onset of clinical symptoms where the patient presents with fever, headache, myalgia, etc. Okay, and also the organism is multiplying in the liver. From there, they can they enter the bile and they re-expose the Peyer's patches again and again where the organism multiplies within the Peyer's patches and the cycle keeps on continuing. Okay. So this is the overall pathogenesis of enteric fever. So after ingestion, they multiply in the Peyer's patches and the mesenteric lymph nodes. From there, you have a primary bacteremia where it seeds the reticuloendothelial system involving liver, spleen and bone marrow, and from there they have a secondary bacteremia with onset of clinical symptoms and there is widespread dissemination into other organs also.